Welcome to final BDS BDC. Corticosteroids is one of the 5 marker questions asked in the subject of oral medicine. Corticosteroids are a class of steroid hormones that are produced in the adrenal cortex and used in various medical treatments for their anti-inflammatory and immunosuppressive properties. Corticosteroids can be broadly classified into two categories, that is glucocorticoids and mineralocorticoids. Glucocorticoids affect carbohydrate, protein and fat metabolism and have potent anti-inflammatory effects. Examples are prednisolone, hydrocortisone and dexamethasone. Mineralocorticoids primarily influence electrolyte and water balance. Examples are aldosterone and fludrocortisone. Mechanism of action. Corticosteroids work by suppressing inflammation. They inhibit the release of inflammatory mediators such as prostaglandins and leukotrienes. Immune suppression. They reduce the activity of the immune system by inhibiting the proliferation of T cells and decreasing the production of antibodies. And cell membrane stabilization. They stabilize the lysosomal and cell membranes, reducing cell permeability and subsequent edema. Indications. Corticosteroids are indicated in the management of various oral conditions like oral lichen planus, pemphigus vulgaris, pemphigoid, erythema multiforme, phthis stomatitis, and Sjogren's syndrome. Administration routes. Corticosteroids can be administered through several routes depending on the condition. Topical administration for localized lesions in conditions like oral lichen planus. Systemic administration like oral or IV administration for severe or widespread conditions. And intralesional administration like direct injection into the lesion for conditions like phthis ulcers. Dosage and duration of corticosteroid therapy vary based on the severity and type of the condition. Higher doses are required for acute flare-ups. Lower maintenance doses are required to control chronic conditions. And tapering, that is, gradual reduction of dosage, is necessary to prevent adrenal insufficiency. The rule of two is a guideline used to identify patients who might need supplemental corticosteroids during stressful situations like while surgery or dental procedures. Patients taking 20 milligrams or more of cortisone or its equivalent for a continuous period of 2 weeks or longer within the last 2 years are at risk of adrenal insufficiency and may require additional steroid coverage during stress. Hence, we should double the dose if any crisis occurs. Adverse effects. Long-term corticosteroid use can lead to several adverse effects, including systemic effects like hyperglycemia, hypertension, osteoporosis, Cushing syndrome, local effects like oral candidiasis, delayed wound healing, and psychological effects such as mood swings and insomnia. Corticosteroids should be used cautiously or avoided in patients with active infections, peptic ulcer disease, uncontrolled diabetes, hypertension, and osteoporosis. Regular monitoring is essential for patients on long-term corticosteroid therapy to manage potential side effects. Blood pressure, blood glucose levels, bone density, and signs of infection all should be monitored. Thank you for watching. If you appreciate this video, do hit the like button, share it with your friends, and please subscribe to my YouTube channel. Stay tuned for more such videos.